So next is rabies vaccine. So coming to the pre-exposure, post-exposure, re-exposure prophylaxis, all these things. So first is post-exposure prophylaxis with rabies vaccine. The potency should be at least more than 2.5 international units per IM dose. So cell culture derived vaccines nama kudukrom. Adla vanda ID and IM we are giving. So ID, if you see, it is a lyophilized dried form, freeze dried form vaccine. The temperature storage is 2 to 8 degrees Celsius, and you have to protect it from sunlight. Okay. Now freezing to not damage the lyophilized vaccine. You have to reconstitute the vaccine. So after reconstitution with the sterile diluent should be used immediately. So use it immediately or within 6 hours after the reconstitution. After 6 hours it can get contaminated, so you have to discard the vial. Okay, the mild reactions are headache, malaise, nausea, all these things, and never switch from one brand to the another. Under unavoidable circumstances, you can actually take the available brand and you can switch it. Okay, so this is the updated thyroid cross regimen, 8 doses and 4 visits, 0, 3, 7, 28. Okay, 0, 3, 7, 28. You are giving it 2 into 0.1 ml. Okay, so 2 into 0.1 ml abdina vandittu 0.1 ml on each side. So how do you take it abdina vandu? See, you take a insulin syringe, 40 units syringe or 40 units syringe எடுத்துக்கிட்டீங்கன்னா 8 units எடுத்துக்கணும், 100 units syringe எடுத்துக்கிட்டீங்கன்னா 20 units எடுத்துக்கணும், which is equal to 0.2 ml. அதில் half, அதாவது 4 units on each side, or you can give 10 units on each side if it is a 100 unit syringe. Okay, 40 unit syringe na 8 units எடுத்துக்கணும், எடுத்துட்டு 4 units on each side you have to inject it intradermally. That under the skin, bevel upwards, and then parallel to the skin you are actually injecting it. Okay, once you inject it, immediately a bleb appears, 3 to 4 millimeters bleb appears with pure orange appearance. The bleb appear ahla appadina, it is not gone intradermal, subcutaneous appoiduchu. Again you have to withdraw the needle and then you have to re-inject another site intradermally. So raised bleb, pure orange appearance varano. If it is not there, seeing there appadina, subcutaneous appoirukku, withdraw and reinsert at the adjacent site and give intradermal vaccine once more. So deltoid region is preferred, suprascapular and anterolateral thigh is preferred. Okay, so after that advice, what you will give? You have to observe the patient 15-20 minutes after giving the vaccine always. Do not rub the injection site, do not apply anything, and complete the course. Mild itching, erythema, body ache, fever, all these things are normal. Now intramuscular 0, 3, 7, 14 and 28. Okay, 0, 3, 7, 14 and 28. That is 0, 3, 7, 28. Here 0, 3, 7, 14, 28. You have to give it 1 dose, okay, on the deltoid region. Deltoid region 1 inch above the insertion of the deltoid muscle. Re-exposure la vandu rendu da irukku, so 0 and 3. Okay, if it's re-exposure is after the post-exposure prophylaxis, within 3 months if there is a bite abdina, wound washing is sufficient, vaccination thevilla. More than 3 months na 0 and 3rd day la you have to go. Now pre-exposure prophylaxis பார்த்தோம்னா 3 doses are recommended pre-exposure prophylaxis க்கு வந்து. Now pre-exposure prophylaxis ல வந்து 0, 7, 21st or 28th day you can give it. Okay, now இந்த patients க்கு வந்து பார்த்தோம்னா first 2 years after giving the pre-exposure யாருக்கு கொடுப்போம்? Veterinarians and those dealing with the forest animals. Now first 2 years க்கு வந்து every 6 months you have to check the neutralizing antibody titer. If it is more than 0.5 international units per ml, it is sufficient. If it is less than 0.5 international units per ml, then you have to go for booster dose. Okay, so 0, 7, 21 or 28. If it is more than 0.5 international units per ml, it is sufficient. If it is less than this, then you have to go for booster dose. So first 2 years 6 months once பண்றோம், after that 2 years once நம்ம வந்து பண்ணி பார்த்து booster dose கொடுத்துக்கிறோம். That is about this. So you have 2 regimens. Okay, you have 2 regimens. Updated thyroid cross regimen, which is intradermal 2, 2, 2, 0, 2. Okay, this is 0. That is 0 அப்படின்றது வந்து the day of exposure, day of visit to the hospital or day of bite. Okay, 0, 3, 7. Okay, 14 day is not there. Okay, and then 28. Okay, 0, 3, 7, 14 and 28 is the SN or IM regimen. Okay, re-exposure க்கு வந்து 0, 3. Pre-exposure க்கு வந்து 0, 7, 21 or 28. And Goa is the rabies free state. Okay, vaccinate your pets against rabies. In severe bites, anti-rabies serum and vaccine therapy is recommended. Okay, and then do not apply dressing. If required, romba large wound irundaduna allow sufficient time, give sufficient time for the immunoglobulin to diffuse. Okay, and main priority is washing the wound immediately to remove the virus as much as possible and to kill the virus, inactivate the virus. Okay, that's all. Thank you.